Thanks so much, Chris. I want to get back to some basics, and the goal of good documentation really includes the complete and accurate capture of information. And one of the things that we recognize is that there are a number of things currently that each single clinician has to document, and when in reality, that information is already in another location. So we all use copy and paste in our various electronic formats. And so it was really natural that we would anticipate that copy and paste would be part of documentation. And here's just kind of an example of what happens. In this initial note, a patient came in and their history indicated that they had no history of TB exposure, despite their recent travel to a TB endemic country. Subsequent visit notes indicated that were copied and pasted related that same negative exposure to TB. However, 2 weeks later, the child was diagnosed in the emergency room with TB meningitis, and they suffered significant residual deficits. So I want to just stop and define copy and paste, because oftentimes we think of it in different terms. So what we're talking about here is really taking information that's in one location and reproducing it in another location. And this can be copying information from the patient's record into a patient portal. It could be copying information from the record to create a discharge summary, or to create a document to facilitate a consultation or a transfer of care. Oftentimes people are lumping other terms, the copy forward, just bringing pieces of the record forward, the pre-population or the autofill, where that information is automatically drawn from another part of the record and pulled into that particular area. Templates are another thing that are often referred to when you're thinking about copying and pasting. And certainly we heard a few minutes ago about macros, or those smart phrases, so the words or phrases that are used that trigger a complete paragraph or a complete sentence or complete information that gets included into the record. When we're thinking about billing and copying and pasting, we're thinking about cloning. So is that exact wording appearing in every single chart? It's an exact duplication of a note. And we really have no need or desire to cut information from the record. So we don't really want to talk about cut and paste. So what it's really clear is what we want to do is we want to reuse the information that's already been documented by someone during the course of care. So what are we talking about? We really want to capture that information. We want to maintain that integrity, the terminology. We want to ensure that that information is reliable. So if I'm copying a neurologist assessment, I want to make certain that I get it right, that it's complete, and that I'm communicating that same information in a way that can be commonly understood. And where do we oftentimes use this? Well, we use it in medication lists. We use it when we have information about complex and chronic conditions. We often want to use it for demographic information, or those kinds of areas that are stable, your medical history, your surgical history, your social history, as well as oftentimes your allergies. And why do we use that in copy and paste? Because it's stable information, and it's very easy to copy it and to get it complete and to update it if we need to. So who does this? Arguably, everybody does it. So it doesn't matter whether you're at registration, whether you're in the ED, whether you're prescribing, whether you're in a specialty area, whether you're in the pharmacy. How are we using it? We're using it for care transitions. We're using it in patient portals. We're using it to try to get information into HIEs or public health reporting. And so we want to be efficient about how we use this information. Why do we use the information? Well, we often use it because other tools just aren't available. So maybe I'm at registration and I'm trying to get the patient's demographics in there, and I don't, I'm time pressured, trying to get this information, gather it quickly, and I can't copy it from a previous record, or I can't pull it forward. So what do I end up doing? I copy it and I paste it. And there's always that chance that I'll get it wrong, that I won't have captured all of that information. The other thing that you oftentimes see is maybe what happens is the information gets copied, but it never gets acted upon. So the example that's listed there on the screen where the patient came in and the intention was, to give her prophylactic therapy, but she never really received that prophylactic therapy, regardless of the fact that it was carried over note after note for a period of days. So copy and paste definitely has benefits. It allows for that complete capture of information. It allows us to reuse information that's documented elsewhere. It allows clinicians and others to really have an understanding of that information, to get it correct. And it also helps to save time. So we're not typing and typing. We just heard how slow most of us type, and some of us type much slower than others. So this time-saving use of copy and paste becomes efficient. It becomes something that is commonly done to really get that information there and to have it be complete and correct. And we know people are doing it. These several studies show that people have admitted they copy and paste routinely. The more they're exposed, the more they copy and paste. And on the flip side, what do we also know that happens is that copy and paste can jeopardize patient safety. And how does it do that? It does that by putting in information that shouldn't be there, having an inability to see where that information came from, having an inability to know when that information was gathered or where it was gathered from. So all of those kinds of things can impact patient safety. And just to kind of highlight those areas, copying and pasting information can create those large, cumbersome notes, what we commonly call Noteblow. It creates those internal inconsistencies where old information may be interposed with the current information. It can create difficulties because there's large amounts of information to view all of a sudden, and you really don't need all of that information. And now you have to sort through tremendous amounts of information to review. It can create cognitive bias, and it can delay decision making. But aside from impacting the timeliness and the accuracy and the efficiency of care, it can also result in legal and compliance concerns. And most of those are related to false billing. And there's other influences that really impact copy and paste documentation, and they're listed here. And they include the onerous documentation requirements that we heard about last week. They include those software issues that we heard. So the unavailability of the tools to assist in documentation, or the ability to reuse that information by some other tool, or whether or not you have macros set up, or whether you can auto-populate. So the usability and the interoperability of the systems, they help to necessitate that use of copy and paste. And documentation is really what's needed to capture and maintain information that's timely, that's complete, that's accurate, so that it can be effectively and efficiently accessed, retrieved, used, and ultimately shared. And so we ultimately need to kind of look at copy and paste in a new light and say, who's using that information? What information's stable? What information needs to be frequently changed and updated? And what tools could be used or made available in this process to make it more efficient, more accurate, and safer for the patients and for the clinicians?